Good Thursday afternoon. I'm Charity Menifee, Director of Communicable and Environmental Disease and Emergency Preparedness here at Knox County Health Department. Our moment of gratitude today is in recognition of Black History Month. We encourage everyone to take time to reflect and celebrate the heritage and achievements of African Americans throughout history, or our history. During the course of this pandemic, we value the relationships formed with organizations in Knox County, such as the Faith Leaders Group, CAC, and others who are committed to providing vaccine education, outreach, and access to our minority communities. So thank you very much. For our KCHD vaccination update, we continue to vaccinate those in the first priority groups, including healthcare workers, first responders, and those 70 and older. For a full list of who qualifies, you can scroll down on our vaccine information page to see a list of all the phases as outlined by the state. As we said on Tuesday, we will update the vaccination data on this webpage tomorrow and will continue to make those updates every Tuesday and Friday. This week, we continue to provide second dose vaccines to those who received their first dose through KCHD at the beginning of January. Next week, we will be working to provide second doses to those living in congregate settings with developmental or intellectual disabilities. This is a priority group as identified by the state and is one that public health is responsible for vaccinating. It requires our team to go out to each congregate setting to provide those immunizations. Because it takes more time and resources for our team to vaccinate this group, we will likely have a lower increase next week for our vaccines administered internally. We will offer additional vaccination opportunities as our resources allow, and we'll make them available to eligible groups as soon as they are available. That said, through the community-wide partnerships that have been established, there will be opportunities for eligible people to receive their first doses through other organizations in our community next week. We are encouraged that more opportunities outside of public health are coming on board to provide vaccination. So be on the lookout for those appointments from some of our community partners coming soon when they make that information available. As we continue to say, the demand for this vaccine continues to greatly outpace the supply. We continue to work with partner agencies in the community to increase access and distribution points for folks to receive the vaccine. It will take more than just us and the hospitals to reach the majority of our community, and we are thankful to the groups that we are working with alongside who are making vaccinations plans to begin this process. Additionally, as we mentioned earlier this week, we continue to coordinate with the hospitals and other partners to share vaccines that are allocated to the county for them to be able to distribute. Before we move into the local situation, I want to recognize the community efforts to push this vaccine out in our community as quickly as possible. This week, we reached an important milestone. Vaccinations in Knox County have surpassed the total number of COVID-19 cases. More than 45,000 vaccinations, including first doses and second doses, have been administered in less than 2 months in Knox County. This would not be possible without the strong partnerships between public health, our regional hospital systems, and other healthcare providers. We look forward to the near future when the number of individuals vaccinated will surpass the total number of cases. And hopefully, we will be recognizing that milestone in the coming weeks. There's still a long way to go, we know that, but it's important that we as a community celebrate these promising steps. Every dose given is a fight against COVID-19, and we will continue to work alongside our partners to provide this much desired protection as quickly as supply and resources allow. Now, moving into the local COVID-19 situation. We have 100 new confirmed cases since yesterday's report. 2,302 are active cases. 78 Knox County residents are currently hospitalized. And sadly, we have 2 additional deaths to report today, raising our total to 490. And now we'll turn towards the benchmarks. All of this data that we are going to talk about is on our website. You can find it at covid.knoxcountytn.gov case-count. Moving to the first benchmark, sustained or reduced stability in new cases for 14 days.
I'm sorry, we're working to pull it up one more time.
You ready? Can I go?
You can keep reading.
I can
We'll
keep
pull
reading.
it up as you keep reading.
Okay, cool. Let's see. So the first benchmark, sustained a reduction in stability in new cases for 14 days. Over this time period, we saw daily new cases drop to approximately 139 cases per day, down from the previous reporting period, which was around 180. As encouraging as these numbers are, the new cases per 100,000 and the percent positive is still higher than what we would like to see. We will review these figures in just a few minutes under our supplemental data. Once again, we want to caution folks against accepting a high level of cases as normal. Even though these are lower than they have been in recent weeks, an average of 100 plus cases per day is still greater than where we would like our community to be. Because of this, we are representing this benchmark as yellow. Our second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test resulting reporting turnaround time. Regarding testing, we have continued to see a decrease in our community. That's also a trend that we are seeing here as well at KCHD. As we stated last week, we are hopeful that this is an indication of a lower burden of disease across the community, but we will continue to keep a close eye on it. We continue to urge anyone who has symptoms or has been exposed to COVID-19 to please get tested. Regarding lab turnaround time, this number continues to be consistent at less than 2 days for the community, which is very good. And because of the lower testing numbers coupled with a shorter lab turnaround time, we are representing this benchmark as a cautious yellow. Our third benchmark, sustained or increased public health capability. We are continuing to restructure this benchmark to better reflect what our public health capability looks like now. As the bulk of the response activities have shifted from case investigations and contact tracing to vaccine distribution, we are evaluating how we can best represent our capacity. While we restructured this benchmark, we are not assigning a traffic light color for this week. We do hope to have an update next week on how this benchmark will be represented moving forward. Our fourth benchmark, healthcare system capabilities remain within current and forecasted surge capacity. During this time period, we have continued to see hospitalization numbers decrease. This is encouraging and something that we hope to continue to see. It's important to note that we are still sitting at a high volume of COVID cases in our hospitals though. It's just not as high as it was several weeks ago. After speaking with our hospital partners, they have recommended that the benchmark be represented as a stable yellow. As always, the hospital systems continue to meet routinely, work together to ensure that no hospital is impacted disproportionately, and plan the response together to best serve this community. The decisions regarding how to classify this benchmark are made in concert with our hospital partners, as well as taking all of the data into consideration. Our fifth benchmark, sustained or decreased COVID-19 related death rate for identified positive or probable cases. During this time period, we have seen 56 deaths associated with COVID-19, which is down from last week, but as a whole, more deaths due to COVID were reported in January compared to any other month. The information available leads us to represent this benchmark as red. As we have said before, deaths tend to lag behind hospitalizations, which lag behind cases. We are hopeful that with the decrease in cases and hospitalizations that we will soon see the number of deaths decrease as well. But this will require everyone to continue practicing the 5 core actions, regardless of vaccination status, to ensure that we don't experience another surge in our community. Under the supplemental data section, the first chart shows new daily COVID cases per 100,000 population. As of Wednesday, our 14-day trend line shows 29 new cases per 100,000, and our 7-day trend line shows 27 new cases per 100,000, which is down from last week, but is still above the threshold identified by the Board of Health. The second chart shows the percent positive for COVID-19. This data was received from the Tennessee Department of Health. The 7-day average for percent positive in Knox County is 13.73%, which is down from last week as well, but above the recession barriers, again, as identified by the Board of Health. And now I'll open it up for questions.
All right, you can input your questions into the chat feature, and just want to say briefly, we apologize. We're having some technical issues with spotlighting our interpreter today, so we want to apologize for that, and we will work to resolve that for briefings going forward. The first question we have is from Cole with WBIR. Who are some of the community partners people should look to for vaccine appointments next week?
You know, out of respect for them, Cole, we are going to wait and let them announce their events, and I'm sure they'll do it through you guys and all their platforms as well, social media. We know, and I think you guys know this as well, as if we name anybody, their phones are going to blow up immediately, and we want to make sure they're ready to handle the volume for anything that's coming their way. So we'll let them announce their vaccine clinics for next week.
From Jeff with WATE, is KCHD planning to use an old Food City building as a mass vaccination site?
That's what we're looking to do. We're hoping to do. We need a place that we can have consistently. When you look at all the logistics that come into scheduling first doses and second doses, especially when we don't always know which type of vaccine we're getting from week to week and what the time frame is between those, we feel it's very important to have a dedicated place that is accessible to everyone, that we can use moving forward. So we're hoping that will work out and we'll be able to be in there in the future.
From Brian Hornback, what is the current schedule for the Board of Health meetings? Every 2 weeks, and when is the next one?
They're every 2 weeks, and the next one will be next Wednesday at February 10th. Thank you. I was getting the actual date at 5 p.m.
From David with WVLT, can we please get an update on the sign-up waiting system?
Yep. We are still working through that process, and we'll put our word when it's up and ready to go as soon as possible. Just want everybody to know that it's not just a waiting system. It's not just a wait list. It's actually a pretty comprehensive system. And so with that, we need to have time to implement it and test it a little bit. But we think that it'll be really good for everybody. If it was just a straight wait list, then we probably could get it going. But we're looking towards being able to have a lot of those processes automated, so we're not having to make calls back or make calls to schedule thousands of appointments for people that are on the wait list. That takes a lot of resources out of our operations to do that. So as soon as we can get an update out, we will, but we're just not quite there yet with implementation.
From Allie with Knox News, the Biden administration has said it isn't holding back doses for second shots, but it is allowing health departments to make that decision for themselves. Will the Tennessee Department of Health be making that decision, or will KCHD get a say in how it distributes doses?
You know, we always try to align with what Tennessee Department of Health is doing. Alleviates confusion with people that are in our surrounding communities. And at this time, we are still getting allocations based on first and second dose.
Her secondary question was, will KCHD hold back doses for second shots or use them up as they're available?
Again, we'll do what Tennessee Department of Health recommends and advises us to do. And at this time, again, we're still getting first and second doses. So what their plans are, you'd have to ask them.
From Brian Hornback, with the 60-day beer license suspension and $7,000 fine of an establishment for continually violating the curfew in Knoxville, is this a reassuring action for KCHD? In other words, you are not beating your head on the wall?
You know, we are always encouraged by people that are working towards ensuring that the Board of Health regulations are followed and the 5 core actions are followed. And we those are there for a reason, and that's to help protect the community. And so we want to make sure that everyone's doing that, and look forward to finding out where we end up with any other actions moving forward. I will say that most of the businesses are doing a great job, and we appreciate that and we're grateful for that, and hope that we continue to move down that path so we see positive impact here in the community.
From Cole with WBIR, do you feel like Knox County has fewer vaccine doses per capita available to the general public than other counties because of the high number of healthcare workers in our area?
Wait,
Workers are the
with that,
public.
yeah, Can you read that one more time? Sorry.
Do you feel like Knox County has fewer vaccine doses per capita available to the general public than other counties because of the high number of healthcare workers?
It's actually distributed by population overall. And then they look at some things like social vulnerability index and that kind of thing to add some doses outside of the actual population allotments. Healthcare workers go into that general population. So it's not really impacted that from that way that I think you were asking about it. But again, we're always happy to see the high number of folks that are wanting the vaccine.
From Cole with WBIR, it says he has some process questions about how vaccine distribution works.
Oh, okay.
Does KCHD direct which organizations, hospitals, urgent care clinics, et cetera, get vaccine in our community?
All right, I'm going to give it a stab, and Dr. B's in the room if need be. So the allocation comes, we get a county-wide allocation, and then our team, Dr. Buchanan and others from our team, talk with all of our providers that are able to distribute, that have been approved to distribute vaccine to get what they're planning to do in the coming weeks. And we work as a group to make those allocations together. The state's deciding how much that we get coming into the community. And then the state also decides who gets activated at this point. So who we are able to bring on board to expand our groups. So all of that, basically there's a lot of conversations that are happening and a lot of information that's being gathered to decide how many an organization can get and then how to fairly allocate that throughout the community. That does not include the long-term care piece. That's a separate federal allocation, but for everybody else vaccinating, it's a group decision.
Cole, I think that answered both components of that question that you had there, but if it didn't, feel free to type something back in. Also from Cole with WBIR, he says another process question. Right now, is it your understanding that TDH is directing vaccine to KCHD, to hospitals, and to long-term care facilities in Knox County? Is there any organization I'm missing that gets vaccine allocations from TDH?
This is also confusing. So it kind of goes a lot of different ways. So long-term care gets it directly. That's through their federal partnership to them outside of the allocation. So the other piece that I talked about, some of those, if they've been activated from the state, they get it directly through from Tennessee Department of Health to that organization. But again, those numbers are based on the numbers we provide feedback to for them on how much to allocate based on the communications that are happening during the week. Other vaccine comes to us, and then we will occasionally work with a partner where we send vaccine management teams with the vaccine to the partner organization for them to actually put the shots in arms.
From Jeff with WATE, any new vaccine appointments coming this weekend? If not, what's happened to this week's allocation compared to last week when we got a heads up Thursday about signups on Friday?
Yeah, so we aren't at this point opening up new vaccines because our focus, like we said in the opening, was second dose vaccines this week, and then also second dose vaccines for our disabled and intellectually delayed.
Intellectually disabled.
Sorry about that. Community. We're going back and doing the second round of vaccines for them. And that takes more resources because it's going to several different locations. And so that's our focus. But like we said in the opening, there will be some first dose vaccine opportunities through some of our partners, and they'll be announcing those soon.
From Cole with WBIR, do you think it's fair for some of the health systems / hospitals in our community to only be giving vaccine to people who are already their customers? And a follow-up was, does that make it more difficult for KCHD to ensure equitable vaccine distribution in our community? No,
within our community, they're actually, they're opening it up to folks throughout the priority groups. We've been working very closely with them on that. And it's not just their clientele.
Any further questions, please go ahead and submit them now. From Claire with WUOT, how many total providers are currently approved to distribute vaccines in the county?
I do not have that number in my head. We could get it back to you, I think. Yeah.
From Cole with WBIR, who wants to go back to the waitlist question. Okay. Do you know if people will be able to see where they are on the waitlist when it goes online?
Don't know at this point in time. So once we get it rolling out, we'll be able to answer those questions better.
Also from Cole with WBIR, if you have recovered from COVID-19, how long are you supposed to wait to get vaccinated and why?
That guidance is a little bit of a gray area guidance as well. So you need to be recovered, meaning that you cannot be actively ill anymore out of your isolation period. That's the hard and fast line. There are recommendations to wait about 90 days. And if you get it earlier than that, you can, but you need to know that you're probably going to have a little bit of a doozy of an immune response to that. And so keep that in mind as well. But those are kind of the parameters right now. I'm getting a note from Dr. B, so I want to make sure that I answer what she's wanting me to add. We also always say talk to your doctor. You have a decreased risk of reinfection within 90 days, which is why the recommendation is to continue wait that 90-day window. Thank you, Dr. Buchanan. And then the reminder I got was also to always make sure you talk with your provider before you move forward if you're concerned.
Jeff with WATE, what sort of screening process was put in place for those partner organizations? Broadly, who are they? Churches, schools?
Mostly right now it's healthcare providers. Can't go into a lot of detail, but there's an application process through the federal government and the state, and then they are vetting and doing all the work to make sure they can store the vaccine properly and all the things that go with that. And then they make the approvals, and then they're at this point still telling us who they've activated that can receive vaccine. So probably some good questions for the state if you want to get more detail there.
From Cole with WBIR, has KCHD ever had to throw away unused vaccine?
I'm not aware of any of it not being used. There have been, I think, a couple of instances where, that there's an issue with a syringe or something like that that happens, but not any unused. We weren't able to get an individual in front of us give the vaccine at this time.
Any further questions? Please go ahead and submit them now. All right, I'm not seeing any other questions come in. Oh, one just came in. From Claire with WUOT, are you still having an issue with people not showing up to appointments?
I think that still is happening a little bit, but I don't know what the rate is at this point. We could get some information from our vaccine team and follow up. But I will use that point. Thank you for asking that question, Claire, to tell folks that it is imperative that you do show up for the appointment that you've received, or if you've gotten vaccine from somebody else before your appointment happens, to please let us know so then we can fill that slot, because we really, the end of the day haul to get those final doses completed is challenging. And so we want to make sure that all the appointments are utilized. I think Dr. Buchanan wants to say something.
Sure. And if you do need to call and cancel, you can call the 215-5555 number. But we prefer that the individual canceling the appointment call and not have someone else call for them unless they can't call.
Yeah.
And then another question from Claire with WUOT. You said last Thursday a wait list would roll out this week. Is that no longer the case? And can you provide a new timeline?
I don't have a new timeline. We're still every day, IT and our team, it's a huge amount of work and they're working diligently towards it, but I don't have the new timeline, but we're trying our best to get it out as soon as possible.
All right, last call. Any further questions? All right, I'm not seeing any others come in, so thank you all for your time, and we'll be back with you for our media briefing on Tuesday of next week. Have a good and safe weekend.